Hi, this is Dr. Shannon and Dr. Ashley, and we'd like to welcome you to our Get Better Faster class. Before we get into the class in detail, I want to give you a little bit of history about Choice Chiropractic and why we're here. I started our business in 1999, and my goal was to create a practice where patients could come, get healthy, and stay healthy for a long time. We're here to help you live in a body that works properly and lasts a long time.
We want you to remember that this is all about you. We're here to make good changes to your body over time and to set you up for success for a really nice, healthy body throughout your lifetime.
Hi, I'm Dr. Shannon Tiroff, President of Choice Chiropractic and Wellness Centers. It's our mission to help you live in a body that works properly and lasts a long time. Now, what does that mean? Nobody has time to be sick or be in pain. We all want to age well, and we want to be able to do what we want to do without interruption. Now, chiropractic became a passion of mine because it focuses on fixing the cause of health problems, and it helps the patient get healthy from the inside out. And it does not rely on drugs and surgery. One of the most important things to understand as you start chiropractic care is the philosophy behind chiropractic. Because quite frankly, it's a lot different from the way that most of us are raised viewing our bodies and health and how to get healthy. So if you take nothing else from what I teach you today, what I want you to understand is what we call in chiropractic the big idea. The big idea is essentially that when we are born, our bodies are innately intelligent. In other words, whenever we come to be, and we're born, our heart knows how to beat the right number of times per minute to keep us alive. Our body knows how to digest food and turn it into the cells that make up our muscles and our skin. We grow up, we turn into adults, and all the processes of the body are happening 24/7 to keep us alive. Now, that intelligence of the body is controlled from the brain through the spinal cord, out through the nerves, to every single cell inside the body. Now, the big idea is that if that intelligence is uninterfered with, the human body will run itself effectively, stay alive, and basically be relatively uneventful as it goes through its lifetime, of course taking into account the limits of time and tissue. We're all going to age. However, when there's interference to that intelligence of the body, when something gets in the way of the brain being able to communicate to the cells or the organs or the muscles, that interference can cause sickness and eventually decay and death. So the subluxation or spinal misalignment is one of the major things that interferes with the brain's ability to communicate with the body properly. Now, when the subluxation occurs, it essentially creates changes in the way the nervous system controls the body. The body loses its natural healthy balance or homeostasis, and literally nothing gets that balance back until you remove the interference. But the good thing is when you remove that interference, your body's own innate drive is to heal itself and make itself whole again. That's what chiropractic is all about. Now, the philosophy of chiropractic is also drugless and non-surgical. That's a huge, important piece of it for a lot of people that seek chiropractic care. So many of us are sick of medicines that fail and the side effects and the scary commercials and, the prospect of surgery. So we're actively looking for ways to help our body fix itself. So using chiropractic and appropriate lifestyle changes, a lot of patients are actually able to get their body to a state of health that they haven't experienced for a long time. So if nothing else, remember that your body is smart and it's designed to heal itself, and it will do that as best it can if you remove interference. I want to talk to you a little bit about symptoms, because a lot of people come to chiropractic treatment because they're experiencing symptoms, most commonly pain. Now, we're taught that symptoms are annoying, inconvenient, and of course in some respects they are. Nobody likes to be sick or be in pain. But symptoms are actually helpful and we need them. For example, when a child has a fever, it's typically because their body is using the fever to cook germs. So the symptom of a fever is productive because it's helping the patient's body heal itself. In the concept of pain, pain is very helpful. So pain is a sign that enough tissue damage has taken place that your body is essentially in an alarmed state. Pain lets us know that something needs to change. Now, unfortunately, in the Western medicine model, we're taught to medicate our symptoms. Essentially, we use the medicine to stop the symptom, even though the medicine doesn't really fix the problem. For example, headaches aren't caused by an aspirin deficiency. A headache is a sign that something is wrong, but we take medicine to cover it up so that we just don't have to pay attention anymore. Taking medicine to cover your symptoms is essentially like telling your body's intelligence to shut up. So, in chiropractic, we tend to not use medicines. In fact, a lot of people come to chiropractic because they want to get off of medicines or change that thing, in their bodies. So the idea behind chiropractic is that as your body gets better, the symptoms will resolve and your body will get back to a natural state of well-being. So you need to know a little bit about how medicine and chiropractic work together. Now, in chiropractic, we're not going to make recommendations about whether to take or not take medicines. That's outside of our scope of practice. You need to talk to your regular doctor about that. However, we will tell you that the less medicine you use, in general, the healthier your body is going to be. So what you need to know about medication use in the United States is that we take about 50% of all of the drugs that are manufactured in the world. But people live longer in 54 countries. In fact, a lot of the problems that we suffer are caused by the medicines themselves. It's estimated in the United States that about 200,000 people die every year from taking the right medication in the right dosage for the right condition. A lot of the medicines that we take now are called continuity drugs, meaning that when the doctor puts you on those medications, there's no plan to ever take you off of those medications. And they include classifications of things like antidepressants, acid reflux drugs, arthritis medications, blood pressure medications, diabetes medications, etc., etc. So if you look at all the drugs that we're taking today, a lot of us are taking a lot of drugs and we're staying sick. And in fact, when we cover our symptoms and we can't listen to what our body's saying, we can end up in a lot worse trouble because we're just ignoring our body's signals.
I'm going to talk to you a little bit about the anatomy of the spine and what we're dealing with every day. This is a plastic human spine, similar in size and shape to one that we all have. We have your hips down low, your lower back, middle back, neck, and then the base of your skull. What happens is when each of your vertebrae here, they're separated by a disc or a shock absorber. When these bones get twisted or shift, bent out of place, they start to put pressure on the nerves. This is what we term the subluxation in chiropractic. Subluxations are important for a couple of reasons. One, they can make you feel sick or cause pain. Two is if they're left untreated long enough, they become persistent, more serious, and cause chronic health issues down the road. You might ask, how do we get a subluxation, or how does my body get twisted or shift out of place? And really, they can start as early as birth with the birthing process, with the heavy force that the doctor will pull the head out of the vaginal canal. And then throughout our lifetime, many, many things can cause a subluxation, whether it's poor posture, a car accident, a sporting injury, or just poor biomechanics at your desk. So the main thing we're working on with you is to remove those subluxations to relieve the pressure off your nerves and really to get you feeling good long term. Another thing is it's important to understand what to expect. Every body is different and everybody's treatment plan was really designed to get them their best that they can be. So it's important to understand, to have realistic expectations for your particular condition. And also, most importantly, is to ask questions. If there's ever anything at all that you're curious about your treatment, what the outcomes are, what we can do differently, what else we can do for you, please ask questions and we'll do our very best to answer them for you. All right, we're going to talk about the importance of good posture, okay? A lot of times those of us who sit at a desk for hours upon hours or are driving long distances throughout the day, what happens is our muscles tend to get weak because over time they get tired, okay? As a result of weak muscles, our head tends to get pushed forward, and as a result we get a lot of muscle spasm coming down from the base of the neck into your shoulders. I'm sure that you've noticed that sometimes if you were to squeeze your shoulder, it'd be really tender or tight. So we have a technique here that pairs really well with the adjustments, and it's called Graston technique. And Graston technique uses these metal instruments, and what it does is it goes against the muscle adhesion to really go in and strip the muscles to loosen up those spasms in order to increase your range of motion and decrease that muscle tenderness. It's really effective for the neck and shoulder region, frozen shoulder, issues like IT band syndrome for those of you that are running a lot and develop a lot of soreness in the hip down through the knee, as well as plantar fasciitis. Okay, so plantar fasciitis can be really, really painful if you're a runner, or if you're waking up in the morning and that first thing when you put your feet on the ground, it's really, really painful at the bottom of your foot. Graston can be really, really helpful for that as well. The other thing I want to talk about right now is importance of sleeping position. I don't know if you know, but the worst sleeping position is on your belly, okay? If you're sleeping on your belly, your head's got propped up one way or the other, forcing your neck into a lot of strain throughout the night. So a lot of times you'll wake up with neck pain or headaches. So we want to make sure you guys are sleeping properly, and the best is sleeping on your back, okay? It keeps all of the curves of the spine nice and neutral. If you have lower back pain, you could always put a pillow under your knees to take pressure off your low back. If you're sleeping on your side, what we ask is that the pillow height is just enough so your head stays nice and neutral. So if you're sleeping on your right side, we don't want too many pillows up so that your head is propped up too high. And we don't want you sleeping on a paper thin pillow either, letting your head drop throughout the night. So if you are a side sleeper, perfectly okay. Just make sure the body is staying really, really nice and square. There are a couple things you can do in addition to help your body sleep more comfortably throughout the night. We carry a line of Cryo Flow pillows, and these pillows are water-based, okay? And the nice thing about a water-based pillow is that you control the amount of water you're putting in it. So you can control how thick or how thin it is. A lot of people love these. This is a small version here, but they actually are full-size bed pillows. So that is something to consider as well. The other thing is, if you do have that desk job or you're in the car all day, is a lumbar support pillow. Okay, so this you just put right on the back of your chair, and that curvature in there allows your lower back to just stay really nice and neutral, and making sure your curve isn't coming out by poor sitting posture. So two really great ways that you can add to your sitting or your sleeping to ease your discomfort and improve your posture as well. So with Graston, what we're focusing on is the tight muscles. So in Sarah's case, she has a lot of muscle tension coming from the base of her skull into her shoulder. So we're going to use the Graston instrument to go against the muscle spasm to really, really work out her muscle adhesions so that we can ease the tension off of her head, get more motion in her upper back, as well as release a lot of her muscle spasm. So to do that, we do a treatment just like this, coming down through the shoulder, to relieve a lot of the muscle adhesion, any scar tissue she may have, and really to increase her mobility. I want to talk a little bit about something else that we offer here at Choice Chiropractic, and that is orthotics, or shoe inserts, as you may know them. Some individuals are born with an anatomically short leg, which means even if we can get their hips really, really nice and straight from the adjustments, they're still going to have a leg length discrepancy, which can alter the way they walk. They may limp or have an altered gait. And in turn, that can cause hip discomfort, knee discomfort, and even down into the ankles. So one thing that has been developed to really help with that are custom shoe inserts. And we use foot levelers, and to use these, we do actually a custom scan of your own foot to properly fit the orthotic for your shoe. There are several different types of orthotics you can get. You can get a luxury custom insert for a dress shoe. You can get for a tennis shoe, a heel, a boot, a sandal, whatever you may like. But these are custom to your own foot to make sure that your ankles aren't falling out to the sides. If you have instability in your ankles from previous injuries or a lot of knee issues as well, orthotics can really help to make sure you have a really nice balanced gait pattern and you're walking properly so that anything from your hips down low can stay really, really nice and even and prevent further pain or discomfort with that. So if you have any other questions about orthotics, we're really, really happy to answer those. Like I said, we can offer a custom scan for you and get you fitted properly for a great pair of orthotics.
As you go through your chiropractic treatment plan, there are some things that you can do on your own that will help you get better faster. Of course, that's what this class is about, right? So one of the main things that I want you to work on doing is to start to get more exercise. You've heard the term move it or lose it, and that's so true with the human body. The human body is designed to move. the more you move, the less pain you have. Additionally, the more you move, the better the brain gets of an idea of where your body is in space. And that's really important as you start to rehabilitate your posture and your muscles and your nervous system. So in the beginning, especially if you're not in the habit of exercising, it can be hard to start. But even if you just do a little bit every day and gradually build upon that, over a period of time, you'll get to a point where exercise is more natural and more comfortable for your body. Great beginner exercises are things like walking, stretching, and water type exercise, like water aerobics or swimming or even just walking in the pool. As you get stronger, you can add in things like resistance exercise, yoga, running, whatever suits your body. Now, if you're already an athlete and you're working on recovering from an injury, what you want to make sure that you do is just don't do too much too fast. So ease back into your workouts, use moderation. If you do a workout and it feels like it's a little bit too much, just back down a little bit at your next session, and then over time gradually increase your challenges until you're back to feeling the way that you like. If you need specific recommendations about exercise, please ask your chiropractor. We'd be happy to help you work that out. Now, in addition to exercise, one of the most simple basic things you can do to keep your body healthy is drink enough water. Most people don't drink enough water. The normal recommendation is 6 to 8 8-ounce glasses per day. Now, what's the big deal? Water essentially is in every cell of our body. The majority of our body is in fact water. In particular with the spine, those discs, the cartilage pads between the bone, they need water to stay healthy. When you don't drink enough water, your body will actually rob water out of the discs and out of the cartilage of the body and use it for things like keeping your blood volume at an appropriate level or getting rid of toxins in the body. So what happens is your cartilage that should be nice and puffy and swollen actually gets shrunken down, dry, and starts to degenerate. So in particular, especially if you think that you have arthritis, water can really be helpful. So it's necessary for bodily functions, but it also helps to keep your cartilage nice and full, which helps you to feel better. Now, last but not least, nutrition is really important as well. Nutrition, best viewed, is like a toolbox for your body. Your body needs things like vitamins, minerals, proteins to rebuild its parts. So when you have a good diet, you give your body good tools and good building blocks to make new parts. When you have a bad diet, your body doesn't have good building materials to work with and it'll build shoddy structures. So number one is making sure that you feed yourself a good, healthy diet. Enough vegetables, enough fruits, enough, clean food so that your body has good nutrients. Additionally, if you want to supplement, we can assist you with that. Nutritional supplementation is very important, especially if you're like most of us and you don't always have the healthiest diet. Now, with nutrition, it's really important to target it specifically to what your concerns are and what your lifestyle is like. In our practice, we use Designs for Health. This particular brand of nutrition has good quality ingredients, it's well sourced, and they have good quality controls. Now, they have a full spectrum of nutrients, but you can't take, nor should you take, everything. So ask your doctor to help you choose appropriate supplementation to help your body get better faster.
I want to talk a little bit about safe lifting techniques today. One of the biggest misconceptions about lifting is that, unless you have a heavy labor job or you're on a job site or lifting 100 pounds a day, then you don't lift throughout the day. Really huge myth, because I've seen patients come in with really bad back injuries that it's from lifting a piece of paper, just using poor biomechanics. So I want to talk to you about the importance of lifting properly, whether it is a 100-pound brick or a piece of paper out of your desk drawer. And one of the biggest things is when you are lifting, it's really important to keep your head really nice and neutral. So you don't want to drop the head while you're lifting, and you don't want to hold your breath either, because as you hold your breath and you drop your head, it really increases the pressure in your spine and can increase the chance for a disc injury. So when we're lifting, we want to stay eyes at the horizon and of course just bend with the knees, so that you're looking really nice and neutral the whole time, breathing the whole time, not holding your breath. One last thing is to avoid overly complicated movements, and what I mean by that is twisting and lifting. So those overly complicated movements increase the chance for a disc injury as well. So the biggest thing is try not to be lazy. You really want to square yourself off to the subject that you're lifting and then just lift just like this, instead of turning and lifting and twisting. Those are just a few tips to make sure that you're lifting properly, again, whether it's that light piece of paper or a really, really heavy object on your work site. All right, I'm going to talk to you about your biggest do's during your treatment with us here at Choice Chiropractic. The first thing is consistency. It's important that you're consistent throughout your treatment plan to gain the maximum results. And what I mean by consistency is keeping your appointments and also working with us as a team to do what we ask you to do at home as well, whether that's home exercise, ice, any restricted activities, paying more attention to what you're doing at work. So teamwork is a huge thing that we really value, and we just ask that if we're working on your case with you, that you're working just as hard as we are. Also, communication is really, really important. We always want to know what's working for you. What do you like that we're doing? What may not be working for you? That way we know exactly what we can do to get you feeling your best in a short amount of time possible.
And last but not least, I want to talk to you a little bit about having a positive attitude and a realistic expectation about what's going to happen to your body. Now, the brain-body connection is so powerful. In fact, it's more powerful, I think, than we even understand at this point. As you're working on getting better, you have to understand that health is really a process. It's a continuum. We don't go from being sick to being healthy in one big leap, nor the other way. So as you're working, understand that every single thing that you do every day either moves your body closer to a state of health or to a state of sickness. So it's literally lots of little decisions as you go. So the more positive you are and the more focused you are on doing the right things for yourself, the more likely you are over time to actually get the result that you want. Now, I always tell my patients, if you think that you're going to get better, you're probably going to get better. And if you think that you're going to stay sick, chances are you get to stay sick. So the good news is that a lot of what you are going to experience is under your control, but you have to control your mind. So focus on what's working right, manage your stress appropriately, and understand that all of those small decisions over time add up to a healthier you. Now, regardless of where you come to us in your lifetime, chiropractic can help. So we see patients from infancy all the way up into being very, very geriatric. We see pregnant patients, we see athletes, we see patients that are struggling with other health issues. So regardless of how you come to the table, doing the right things, removing interference, turning your body's power on from the inside out, you can help yourself get better. So I always think that we're so lucky to be chiropractors because we have such a high probability of helping people get better. In fact, when you look at satisfaction ratings, people that are treated with chiropractic treatment are 92% likely to say that they were very satisfied with their treatment. Now, this score was higher than any other type of healthcare practitioner that takes care of back pain. So I always love being a chiropractor because I think that chiropractic works so well because it's in line with what the body does anyway. So one of the things that is super inspiring to us is our success stories, and I want to share one with you briefly today. There are so many to choose from, but this one really stands out to me. This gentleman that I'm going to tell his story started with our office about 3 years ago. When he came in, he literally could not stand up straight. He was bent forward. He was really, really distressed. He was having excruciating muscle spasms. In fact, he was almost in tears. And he was really nervous to come to a chiropractor. He had been to a chiropractor 15 years prior, had a strange experience, wasn't totally comfortable with it, and decided he was never ever going to go back. But he literally had had these excruciating episodes of back pain for 15 years ever since then. And the women in his office basically forced him to come and see me. So he came to see me and we did a really thorough exam, and I told him that I thought I could help him, and he said, "Please don't hurt me." I assured him that I wouldn't. And what was really great was that he started to get adjusted and he started to get better, and he trusted us and he worked with us, and his back pain went away. And in fact, he has not had an episode of back pain since he's been started with treatment. Now, an interesting side note to this was, a couple of years ago, actually probably about a year and a half ago, we were working together and I was sort of pushing him to exercise more. And he said to me, "Dr. Shannon, I just can't. every time I exercise, every time I try to walk fast, I just lose my breath, I get so out of breath, and I have to use my inhaler, and he just hadn't been able to exercise. So we actually started working on that with him and started working on different parts of his body, not even knowing that that was a problem initially, and then that started to change. So he was able to start to walk more, and this became even more important to him because he had his first grandchild. And anybody who's a grandparent knows that having grandkids is one of the best things that ever happens to you. Now, prior to working on his body, he wouldn't have been able to play with his grandson, he wouldn't have been able to push him in a stroller and take walks, but now he's able to do all of those things because he feels good, he's able to breathe better, and all of that has resulted in him being healthier. So he went literally from being completely petrified to be in our office to somebody that comes in monthly now for wellness and is really excited about his adjustments. And that's why we do what we do. When we can make a difference in somebody's life like that, that's what makes us every day be glad that we're chiropractors, and we want to create that change for you.
Throughout our class today, we really have taught you all of the tools you need to set yourself up for success. Most importantly, we ask that you keep your appointments, you stay consistent with your care here at the office, and that you communicate with us clearly about what is helping you and what we can do for you to get well and keep you well for a long time. I'm sure throughout today that you may have thought of someone you know who could benefit from all of the services that we provide here at Choice. So we ask that if you do know someone, a family friend, a coworker, your child or your parent, that you ask that they come see us and that to see how we could help them. We'll always do a really nice thorough exam and a full consultation to see how we can help them, and if we can help them, we'll certainly let them know. Last but not least, we do a lot of community service here at Choice, and we're always looking for ways to be out in the community to convey our message to everyone else. One of the biggest things is the lack of education about chiropractic in the community and all of the things that chiropractic can help with. So if you know of an organization or your own business that may benefit from having a presentation or a wellness fair at their office to raise awareness about workplace wellness or lifetime wellness, we're really happy to extend our expertise and share with your company as well.
And there's all different ways to find us. So we encourage patients to communicate with us. You can find us on the web at www.choicechiropractic.net. We have a Facebook page and we have Twitter. If you ever have a question, all you need to do is click on the Ask the Doctor button on our website, and we'll be happy to answer you as soon as possible. Thank you so much for your time. We look forward to working with you.